The ribs, good. So we have our ribs also lining our lungs, okay? This is the left lung and this is the right lung, and we can see the divisions of our airway passage tube kind of splitting into our lungs. Okay, so our right lung has 3 lobes. Because it has 3 lobes, it has 2 fissures, and this is not the best image for the fissures. We'll look at the fissures in the next image, but you have a horizontal fissure and an oblique fissure, okay? Our left lung only has 2 lobes and 1 fissure, so it has this big, long, oblique fissure. Because our heart is on the left side of our body, it also has a very large cardiac notch and impression. If you look at an atlas, you'll also see a cardiac impression on the right lung, just a little bit, but it's a lot smaller than on the left lung, so just be aware of that. And the heart kind of touches the right lung a little bit, makes sense, they're like right next to each other, so there is a tiny cardiac impression. The hilum of the lung is located on our mediastinal surface, so it's located more medially on each lung, okay? A hilum it's like a doorway, essentially, for things to pass through, and it's where all of our structures are gonna enter and exit our lung, okay? So like the hilum is the actual door, and the root is the actual structure, so the people passing through the door. Does that make sense? Okay. So our hilum is also, it's located medially, and it surrounds the structures like our blood vessels and our bronchi that are entering the lungs, and then the root are those actual structures, like the blood vessels, nerves, and bronchi. So we can see here our different fissures. So this is the right lung, okay? We can see this long oblique fissure, okay? And it looks, if you were to compare both lungs, the oblique fissure almost looks the same in both lungs, right? It's pretty long and it comes down. This is the left lung, this is the right lung, and we have an oblique fissure. But our right lung has 1 extra lobe. So we have our horizontal fissure coming off of our oblique. That's kind of how I think of it. And it's horizontal or transverse in nature. So we have the superior, middle, and inferior lobe of our right lung, and then we just have a superior and inferior lobe of our left lung because of this huge cardiac notch. Okay, do you guys have any questions about that? No? Okay. We also have the hilum of our lung, so located, we're looking at the medial view of each lung here, the right and the left. We have this hilum, which is this right here. You can see here. And then the root are the contents, so like we have the blood vessels here and our bronchi. We should also have nerves in here, but they're pretty small, so you can't see them on the edge. Okay, so this is a view, an anterior view of the lungs with the anterior thoracic cage completely removed. So you can look in here, and we have the right lung on this side and the left lung on this side. It's a little bit hard to see the fissures, they're more lateral. But our oblique fissure would be like coming down like this, and then this is probably the horizontal, and then this is the oblique fissure of the left lung. And our heart really dives into that left lung. So you have this huge cardiac notch of the left lung located kind of on the medial surface. And then it still does touch the right lung, so this like right here would be the cardiac impression of the right lung. That's why I just pointed out in case you guys like look at something. Okay, so our anterior thoracic cage and our posterior thoracic cage have intercostal muscles. We have 3 types of intercostal muscles. We have our external, our internal, and our innermost intercostals. okay, and they fill the space between the ribs, okay? So our external intercostals kind of, they go towards like putting your hands in your pockets. That's kind of how our external intercostals would look. Our internal intercostals run like this. The innervation is through the intercostal nerves, okay? And in between our internal and our innermost intercostal, we have our vein, artery, and nerve traveling through, okay? So our plane, our neurovascular plane is located between our internal and our innermost intercostals, okay? And they travel in that costal groove of our rib that you guys should have already looked at and know and be very familiar with. So if we were to tag something underneath a rib, that would be the costal groove. We could ask you what blood vessels run there. It's a great practical question, just throwing it out there. And they run in the order from superior to inferior vein. So we have our intercostal vein, artery, and nerve. We're gonna look at the vein and artery. It's always called the intercostal nerve, right? Because you only have one spinal cord where our nerves come from, okay? So they're one long intercostal nerve is gonna come from our spinal cord, but we have anterior and posterior intercostal veins depending on which part of our thorax we're looking at, okay? So, you can see here, this is just the image. You have underneath the rib, you have the costal groove, and that is where our vein, artery, and nerve are traveling. We also have collaterals running above each rib. Sorry, I forgot the word for the bone. Collaterals that are really small and you don't generally see them, okay? Unless you like really spend time meticulously picking out the muscle. And you can see that they're running in between